Congressman, thanks for taking the time to talk with me today and
pleasure.
stopping by. We're here outside. Partly, we're all keeping carefully, and I may have at least got 3 feet, I think, here, so we're doing our best. So first, I just want to ask you, you were in Washington through late Friday into Saturday, right, for the vote on the coronavirus aid bill. What's the mood like in Washington among representatives as well as senators on Capitol Hill?
Look, I think there's a sense of urgency, no doubt. People recognize this is unprecedented in modern American history, that there's an awful lot of uncertainty for families, for individuals. People want access to information. There's a lot of information out there. Part of it is because it does evolve rapidly, and people want to make sure that they're protecting themselves, taking care of themselves, and protecting their families. And a big part of that is, I think, what that goal from the legislation was, that went late into early Saturday morning, to provide some semblance of reassurance to an American public that if you need to get it tested, that the cost of those tests is going to be covered. That if you you lose your job during the midst of this crisis, that there's going to be enhanced unemployment insurance, that there's going to be enhancements to paid sick leave, and we need to do more there. The Speaker pushed very, very hard in the midst of some shocking pushback from the administration, but that folks need to be able to have the confidence to know that, one, we are going to get through this. We each can do something to shorten the time and duration of this crisis. Engaging in that social distancing that we're doing at the moment, stay home, wash your hands, wipe down those frequently touched surfaces, wipe down your phone, try to stay healthy. And if we do that we'll get through this with far less disruption than we otherwise would. But part of that is also the federal government providing that assurance that we're going to be there, and we'll come out of this all right. We each have to do our part, though.
Without just repeating the question in a different way, you've been now back in your district as well, and you're going statewide now as a Senate candidate. What do you hear from, I'm sure you're talking to mayors, you're talking to state lawmakers, you're talking to business owners. I mean, what's the feeling out there as you go around keeping your distance but listening?
So, look, a lot of that obviously on the phone, a lot of that even now virtually. But yes, spent much of the time last week actually down in Washington on the phone with folks back up here, and now that you're up here, a lot of time with folks, our leadership and folks down in D.C., trying to relay that message, relaying the concerns from first responders that they don't have access to enough equipment, relaying concerns from community health centers about the enormous economic burden that could be put on them, and make sure that they're ready for this if it does hit as people think it might, hospitals and others. And the concern, I think, is some uncertainty as to just what is going to happen, but two, that everybody's doing everything they can to be as prepared as they can be. And then critically, Ted, the request to everybody else that we actually, as much as this feels like it's something way out beyond your control, that each of us actually can do something to impact the severity and duration of it. And that does mean that, yes, we're asking folks to take on a significant burden at the moment by engaging in that social distancing, staying at home, caring for your kids, doing everything you can to limit your social interaction. But if we do that, we're going to be able to tolerate through this and to work through it far more quickly, far more effectively, with much less disruption, much fewer people getting sick, than if you try to go about it as if it's business as usual. And that's why we need everybody's help in this.
So Governor Baker last night closed most bars and restaurants except for takeout, I believe. Governor Raimondo and Rhode Island doing the same today. A lot of talk now of the next bill. You just passed one. You're going to start looking at another one, stimulus. What kind of measures do you think need to be top of mind in a further stimulus bill, as Speaker Pelosi has discussed?
So, Ted, I was on the floor with Speaker Pelosi at 12:30 in the morning, Friday night, Saturday morning, whatever it was. And she was already focused then on the next bill. I spoke with her over the weekend, again, focused on the next bill. And I think we've got a call later this afternoon that is going to be talking about what the basic pieces of that are. And I think there's a lot that needs to be done. From my perspective, a couple things. One, investments in our community health centers, ensuring that they're going to have the resources that they need. We've already made one investment in them. We're going to need to make an awful lot more. Two, making sure that individuals and families that fall through the cracks of some of our labor law, franchisees, gig economy workers that still don't have access to paid leave, they make sure that they're covered, not just because it's the right thing to do, but if you've got somebody that is an Uber driver and doesn't get access to it and they're sick, but they have to make ends meet, they're going to keep driving, which means more people are going to get sick. This is how you have to respond to a pandemic. Three, I do think that we got to start looking at things like direct cash payments to individuals, so that you keep, for folks that have to find a way to pay their rent bill, or their mortgage, or their car payment or phone payment, that they have the ability to to make that payment, to keep liquidity through that system, to keep our system functioning, so that things don't come to a screeching halt. And then, of course, the potential need for sector by sector investment. Clearly, the airline industry is facing potential devastation.
Some Democrats are going to say, "Ooh, could those be bailouts?" You're open to that?
I think we have to look at it, and I think there's one thing, Ted. Again, if people engage in these practices so that the disruption here is in the short number of weeks, that's one thing. If we don't, and again, this varies a little bit across the country, but if this is as bad as folks think it might be, and it's weeks after weeks, that's a different story. And I do think there's things we can do now to move aggressively on the front end to limit that pain on the back end. But I do think we got to look at this not as what we're taking off the table, but as saying to critical aspects of our economy, this is what we will do in order to make sure that the American public has confidence that our system is not going to shut down.
You mentioned paid leave. There was a tough New York Times opinion piece saying Democrats did not fight hard enough to expand the percentage of Americans who are covered by the paid leave guarantees in the bill that's currently, as we speak, before the Senate. What do you say to that criticism? That was Democrats' job to get that.
I think if anybody thinks that Speaker Pelosi doesn't know how to fight, you should spend some time with Speaker Pelosi. I spoke with her again on the House floor that night. I spoke with her over the weekend. It was that was the focus of her conversation, was ensuring that American families have the tools that they need to get through this crisis. She referred to this negotiation as one of the hardest she's ever had in her career, which I found stunning given the crisis that we're in, that it wasn't being met with a kind of immediate response from the administration of, hey, you're right, this is something we need to do, but was being met with resistance. And so I think she pushed as hard as she possibly could. I know that, in order to get to where we needed to be now. I do think that, as she said, the moment that was done, we're on to the next one. And we have to ensure that individuals that fall through the cracks in our system, that they are caught, not, again, just because it is the right thing to do, and it is, but because if you're talking about stemming the spread of a pandemic, we need to make sure that there's nobody across our system that has to make that choice of keeping a roof over their head, providing for their family, or potentially getting sick. If we force that choice on them, they're going to get sick and they're going to keep spreading it. We need to get in front of this, and I would hope the administration finally comes to grips with that.
So, gotta just ask about politics. You are a U.S. Senate candidate right now. Not easy to campaign when we're saying don't go near anybody, don't touch anybody, don't spend time together. That's not exactly how politics usually works. I mean, I know you won't want to say too much political, but, I assume you guys are readjusting your campaign strategy knowing that September 1st isn't changing.
Yeah, so obviously, look, we've been out and about across the state an awful lot, running a very aggressive retail campaign. A lot of high fives, a lot of fist bumps, a lot of handshakes, a lot of hugs. You can't do any of that. And rightfully so. Look, this is a time where I think every American is concerned about their health and safety of their families. We want to make sure for our supporters that they take care of themselves, that I take care of myself and our campaign team, and that you certainly don't provide any opportunity for this virus to spread. That's the number one responsibility, is the health and safety of our people. We have put in a temporary suspension of campaign activities through the course of this upcoming weekend. We'll reevaluate on it as needed.
Your debate was actually postponed. Your next one.
And, we engaged with the organizers on it. Senator Markey has to be down in Washington. It was unexpected, so no issue there on that. We will reschedule it. We look forward to that debate. But look, clearly disruptive for every candidate, and across the board, Democrat, Republican, anybody. But the primary responsibility of anybody that seeks to be in public service is the safety and security of the American public, and that's what the times call for. That's what we will do. It does mean we're doing an awful lot virtually. But that means, again, for this moment, trying to make sure that the public has access to clear, accurate, reliable, and up-to-date information on this virus. So we've did our first teletown hall last night, focused on the virus with a friend and fellow representative from the Massachusetts State Legislature, who's also an emergency room physician, who spoke about what he's seeing at Boston Medical Center. We'll do a series of other ones over the course of the week, but again, focus on communication from the virus, because that's what people need at the moment, and I think that's the responsibility that we have.
Last question.
Yeah.
You talk to experts, you're in Congress, you hear what the CDC is telling you, you have friends who are doctors, et cetera. What do you think 4th District residents and all Americans should be preparing themselves for as of today?
Look, by far the most important thing is listen to those experts, engage in the activities that they're talking about. At this point, social distancing, right? Again, washing your hands. When you get home, wash your hands before you eat, before you touch your face, which is hard. I think people are realizing how often they touch their face, right? It's a good excuse to stop biting your nails, right? But engage in those practices so we do everything we can to stop the spread of this disease. Call in and check in on other folks, right? Anxiety level at the moment is high. You're seeing that with regards to people who have loved ones that are sick, people with young children and older parents. People are afraid. You're seeing that in the markets. People are enormous volatility. People are nervous. Reach out to people. Drop them a note, shoot a text message, just let people know you're thinking about them. If we do that, and we do this right for the next 2 weeks or so, we are going to be